Hi guys, welcome to this short video looking at special tests of the hip. We're going to go through 4 tests. The first 3 will be identifying labral tears, looking at anterior and posterior. And the 4th test will be identifying ligamentum teres tears. Okay guys, now we're going to look at a modified Thomas test to assess for labral tears. Okay, so if we get Ben to come and back into the couch so that he feels it on the back of his legs, we're going to be looking at the left side. So if you take your right knee up for me, I'm just going to guide you back, okay, and there's a pillow there for your head. What I'm going to do now, I'm going to bring his hip up into flexion, I'm going to stabilise his pelvis, and my thumb is sitting on his ASIS, and I'm just going to passively lower his hip into extension. What constitutes a positive test here is clicking or catching with associated pain. So again, I'll show you that one more time. Stabilising through here and slowly bringing the hip down into extension. Monitoring for clicking or catching, which would be a positive response with pain. Okay guys, now we're going to look at the Fitzgerald test. This is a really good test for identifying anterior labral tears. Okay, this is a dynamic test, so we're going to bring Ben's hip up into maximal flexion, maximal abduction, and maximal external rotation, okay? And from here, we're going to scoop his hip into adduction, internal rotation, and extension, okay? Positive test here again is catching or grinding associated with pain. So I'll do that one more time. Flexion, abduction, external rotation, adduction, internal rotation, extension. Okay guys, now we're going to look at the Fitzgerald test specifically for posterior labral tears. Okay, so from this position we're going to start from maximal flexion, maximal adduction and internal rotation. Okay, and from here we're going to scoop the hip into maximal abduction, external rotation and extension. Okay, one more time. We start from flexion, internal rotation, adduction, and we're going to scoop the hip into abduction, external rotation and extension. Okay, positive result on that test is clicking, catching or pain, usually in the gluteal region or posterior hip. Okay guys, now we're going to look at the grind test, which is another test for labral tears. So in this position I'm going to bend the hip up into 110 degrees flexion, and then I'm going to add on 10 degrees adduction, adduction, then I'm going to put some axial loading through his femur, and from here I'm going to bring him into internal rotation and then external rotation whilst I maintain the loading component. I'm going to his available range, and what we're looking for here, same as the other test, clicking or catching associated with his pain is a positive test. Okay guys, now we're going to look at the O'Donnell's test, which is a very valid test for identifying ligamentum teres tears. Okay, so I'm going to take the hip and I'm going to bring it into full flexion, yeah, and from there I'm going to take it back to around 70 degrees. What I'm going to do then is I'm going to take it into full abduction, and then I'm going to bring it back into 30 degrees. I'm going to hold that position, so 70 degrees hip flexion, 30 degrees hip abduction. Now I'm going to externally rotate the hip, and then I'm going to internally rotate the hip, looking at what the available range is, and a positive test would be reproduction of pain and would indicate a ligamentum teres tear. Hi guys, hope you enjoyed that short video looking at special tests of the hip. On the course itself we go through lots of other assessment techniques looking at articular and extra-articular structures, and we go through lots of manual therapy techniques and lots of exercises as well. For more information on that course, click on the link below.